Thanks for joining us today and for being on our show.
Thank you for having me.
If you want to introduce yourself and tell us what you do.
So my name is Tara Erson. I'm a dentist. I graduated in 2012. And originally I was just interested in doing regular kids dentistry. That was kind of always my goal. I didn't specialize in children. I'm a general dentist, but I wanted to limit my practice to children. But I also had my first child right after I graduated dental school. So I spent a lot of time in the lactation community with him, going to La Leche League meetings and stuff like that. And I started hearing about this thing called tongue tie. And at the time I had no idea what it was. I did not learn about it in dental school. And I basically just started taking classes. And over the last 5 years, I've created a practice where that's pretty much all we do. We've added some more things more recently, but yeah, my practice is called Smart Mouth. It's here in Las Vegas, and I see a lot of infants with breastfeeding issues, but among others, I do see all ages kind of for all tongue related issues.
So if you would tell our listeners, what does tongue-tied mean?
So, there have been efforts to kind of create a definition of tongue tie. I think the biggest problem is that everyone has a different definition of what it is. For, let's say, pediatricians, they might consider that if the string under the tongue comes all the way to the tip of the tongue and you literally cannot lift or move your tongue at all, that's what tongue-tied means. But I, and the people that kind of do what I do, our definition is more broad. Basically, if there is any restriction under the tongue that is keeping your tongue from doing all of the things that a tongue should do, then that's a tongue tie. If your tongue can do all the things that a tongue should do, then you don't have a tongue tie, regardless of what it looks like under your tongue. So it's really a functional issue and less of a visual thing. However, I will say that when it is super obvious or very close to the tip of the tongue, then I've pretty much never seen a case where that's not, a functional issue as well. But there are lots and lots of cases where it's less obvious visually and it's still causing. And the functional issues that can be affected are starting from breastfeeding in infants, bottle feeding, solid foods, speech issues. Those are most of the childhood issues that I see. But it gets more complicated, that we can talk about that later, but how the tongue affects jaw and facial development and airway issues as well. So I treat that in adults too, and older kids.
So what brought you to Vegas? We'll get some more details about you personally first, but then I think it'd be really interesting to do a deep dive into the anatomy and how some of those things are affected for sure.
So I was actually born here, born in Las Vegas. I spent, let's see, two years in LA. I started college. I actually took a break, came home for a year and did AmeriCorps. Just wanted to make sure that my goals were aligned with what I thought my goals were. I decided that they were. I went back to LA. I finished college there and then came back home for dental school. So, I'm 38 years old and I've spent all but about 5 years here in Las Vegas. So I definitely home to me. It's my community. There's a lot of that in what I do, that drive to improve, health care in this community.
Did you know you always wanted to be a dentist from the beginning, or is that something that you just decided over time?
Well, when I was little, I loved going to the dentist. It's kind of a freak. I remember collecting all the stickers I would get every time I'd get a cleaning. But I just loved my dentist. I just thought he was a cool guy. My mom would tell me anecdotes like, oh, hey, you know, Dr. Joe donated a dinosaur to the Natural History Museum. Like that dinosaur that you saw, that one was donated by Dr. Joe. And I just thought, you know, I want to do stuff like that. Like I want to, if that's what you got to do, if you got to be a dentist to be able to donate cool dinosaurs to the museum, like I can do that. And I was always fascinated by teeth. I thought it was great. And so literally from about the time I could talk, I had decided that I was going to be a dentist. And that says a lot about my personality. I kind of go all in when there's something that I'm interested in. So I never imagined that I wouldn't be working with teeth anymore. And, you know, in the micro sense, I don't do fillings anymore. I never really did adult dentistry, crowns and bridges and stuff like that. But I love what I do now more than I could have ever imagined. So it's good.
That's excellent. And what made you take the pediatric route as opposed to working with adults?
Again, I just, you know, I don't know if it's because it was a pediatric dentist who inspired me, but it was never, I'm going to be a regular dentist. It was, I'm going to be a dentist for kids. So
you're probably worried too that if you're an adult, you can't donate those dinosaurs. So, you know,
yeah, I don't know. I mean, you got to follow the rules. Like it was a
right.
kid's dentist who did that. Yeah. And so I didn't specialize in pediatrics, but with dentistry, you know, when you graduate, you're kind of have the skills you need to do whatever parts of dentistry you want to. And that's just, I had decided I was going to limit my practice to children, which helps a lot with what I do now, right? Because again, most of my patients that walk through my door are kids, and it's just, I enjoy it. I love working with them. So I still get to use that part of my goal. I can still donate the dinosaur someday because I'm a dentist working with kids. So
excellent. And when you're not busy being a dentist in Vegas, what else do you do? Or how do you spend your time?
Oh, I have 3 children. So that answers that question. Literally every moment that I'm not doing work, I'm doing something for my 3 boys. They're 1, 6, and 9. And then my husband, we've been together almost 20 years now. So it's busy. It's busy. It's not going to say it's magical or anything. Kids is not all it's cracked up to be, but it's good.
And are you at your clinic right now?
Yes, I am.
Excellent.
Yeah.
And so tell us a little bit more about the anatomy of tongue-tied and some of the influences on how things develop that you were speaking of earlier.
Yeah, so I think the thing that people don't really know, because I sure didn't know it and I sure didn't learn it in dental school, was that our tongue is supposed to live pushed up against the roof of your mouth. From the tip of your tongue right behind your 2 front teeth, I always say say N, where the tip of your tongue touches. And when you say N, that's called your spot, your tongue spot. And that's where the tip of your tongue is supposed to rest all the time. If you're not talking or eating, that's where your tongue should be. But then from there, the rest of the tongue should actually be pushed up against your palate, all of your hard palate. And so when I was taught that, I went, that's crazy. My tongue has never done that. You know, I'm 34 years old, I remember saying, and my tongue has never lived on the roof of my mouth. You're crazy. And then I realized that's why I had braces 3 times. And my roof of my mouth is super high and narrow because your tongue in infancy and childhood literally shapes your palate. And actually, I should say, even in utero, your tongue is shaping your palate. And so if your tongue is down on the floor of your mouth all the time, not acting as that scaffolding, holding that palate in place, guiding it in the right direction, the only muscles that you have acting forces on that upper jaw are your cheeks pushing in, lips pushing back. And so it really bubbles that palate. which then makes it even harder to get your tongue up where it belongs, because instead of being wide and flat up there, it's high and narrow. Obviously, in my world, I see tongue-tied babies. They are a couple weeks old and they already have these high palates. Well, that's because they're tongue-tied. So in utero, when their palate was shaping, they couldn't get their tongue up there where it belonged. And so their cheeks were already starting to, put that inward pressure and make that palate higher and narrower. So then they're born, they have a tongue tie, their palate is high and narrow. They have to make contact, in breastfeeding, the breast goes between the palate and the tongue, and they have to make contact with that whole complex, palate, breast, tongue. And the higher the palate and the more tight the tongue, the harder that's going to be to accomplish. And so that's kind of the basics of why so many people have breastfeeding issues with tongue-tied babies. Now, there are a lot of variables. There's a lot of compensations if a mom makes just a lot of milk, kind of no matter what. Sometimes they're not really having breastfeeding issues because baby doesn't have to work very hard to get the milk. So, there's no one scenario for every tongue-tied dyad. But the fact of the matter is now we have these, anatomical changes with that high palate. And with the tongue, they were supposed to spend months 3 to 9 practicing how to use the tongue properly so that when they come out, they can eat well. Well, as you know, as physical therapists, muscles, if they're weak, it's not like you can just wave a magic wand and teach a person how to use that muscle properly. So you've got this baby that comes out, I can cut a tongue tie. I mean, that's really the easy part about what I do. But just because I cut it doesn't mean that that baby is instantly going to know what to do with their tongue. And so I refer a lot to pediatric infant feeding therapists, who I call the personal trainer of the mouth, because they have to teach that baby how to use their tongue properly. And if there is one thing that I can impart to families that come into my office, it's that I'm not doing the most important part. I am removing a roadblock to reach goals. And that goal is for baby or child, anyone, to learn how to use their tongue properly. So that comes back to, me as a 34-year-old going, but, where's my tongue supposed to be? Like, how does that work? And you're supposed to swallow in a way. Like, I always just ate my food and drank my water and I didn't choke, and I thought that was fine. But then I learned, it's very similar. You've got this ball of food or water in your mouth and you're supposed to put your tongue tip to that end spot and then lift it up and back. And that is how you swallow, which maintains that, nice flat, wide palate and keeps your lymphatic system moving. And it just kind of all works together that way. So, I think what really blew my mind was this muscle in our mouth, the tongue, which is actually so important for speaking and eating, which are arguably, two of the most important things we do as humans. Nobody pays attention to it. Nobody really talks about it. And so that really is what kickstarted my complete 180 change from doing regular dentistry to focusing specifically on the tongue.
So how did you ever figure out that that was a thing? So you started working with teeth initially, and you said you found this out at 34. Was it a course that you took, or was it?
No, so it was literally people in the lactation community. They would find out I was a dentist and they'd say, oh, do you know about tongue tie? And I'd go, no, what's that? Never heard of it. And they'd go, well, it really affects breastfeeding. And with my first son, it was literally magically easy. the way I expected breastfeeding to be. And so I went, I don't know. Breastfeeding's easy to me. Never heard of tongue tie. And I was just kind of so focused on being a new mom and a new dentist. And I was like, I don't really have time for this. But, and that was 2012. It took until about 2016 for someone to convince me that I really needed to go learn or something. So I actually went and shadowed an ENT in Portland for a half day. He was very gracious to allow people to do that back then. And I just watched, and I watched him do some consults, and I watched him do some procedures, and I went, they're right. There's something to this. This is pretty crazy. These babies were struggling to nurse, and so many times this 30-second procedure, they would, take the baby away, do this 30-second procedure, bring baby back, and it would be better. Like, okay, well, that, it's really hard to equate that to something else when you have all these different situations where baby's been struggling for weeks or months, and then suddenly it's improved. So that convinced me enough to learn more about it. And so then I did start taking classes, and the more classes I took, the more convinced I was. And I do actually doing frenectomies in my practice. I mean, I did one every once in a while when I would get a referral. I mean, I had reached out to some midwives and lactation consultants in town and said, this is something I'm learning more about. I've heard there's a need. Send me your cases who can't afford to go anywhere else. Like, I want to learn more about it. So whatever it takes to kind of get more experience, I'm willing to do it. And then just every time I did it, it was almost magical, And I'll step aside here for a minute. Like, that first feed after a release is often like that. It's often magical because instinct kicks in, and baby's like, whoa, I can use my tongue. Couldn't do that before. And then just like any exercise that you do for the first time, now your muscles are fatigued. And so I always remind parents that you're going to go home and it's not going to be like that again, because now baby's going to be exhausted. This muscle is sore. They're also in pain from the procedure. They're overwhelmed, confused. Their tongue doesn't work the same way anymore. And so now it's the hard work of relearning how to use it properly. But, and a lot of what I have learned over the years, things that I couldn't even be taught in a class, is how to triage consultations and try to make that determination of, is this a baby who's ready? Is the tongue tie the last thing holding them back from success? Or do they have no idea how to use their tongue? And again, it would be a waste of time to cut the tongue tie at this point, because they're still not going to know how to use their tongue after, and they need that therapy first. So I put a lot of effort into that with my patients and they get disappointed, they're like, oh, well, my so-and-so told me that, the tongue tie was the problem. That's why they sent me here, for you to fix it. Like, yeah, the tongue tie might've been the original problem, but now we have bad habits and bad compensations, which again, correlates a lot to like the physical therapy world. You see people walk in with compensations and they think, that's fine. But it's like, until you undo those compensations and start teaching them the right way, they're not going to see habitual change. So I always say, just because I'm a dentist, a tongue tie procedure is more like a shoulder replacement than a filling. A filling is, you come in, you get it done, I pat you on the back and say, see you in 6 months. And it's easy and awesome. Tongue tie procedure, it's like, I got to hold your hand, for the next 4 weeks, if not longer, and help be the quarterback to guide you through the right process of of what you need to do for success. So it's much more complicated. And that's my beef with dentists who treat it like a filling, you know, who, oh, I do tongue tie procedures. Come on in, you know. Yeah, I know it's quick, it's easy. It's, again, the easiest part about what I do, but it's not, it's literally like the least of it. The education and the guidance and the follow-ups and the hand-holding is really kind of what I consider myself to be my specialty.
And after that procedure then, well, first you want to describe the procedure, and then after the procedure, did you say that you work with them, or is it someone else that works with them after that point?
From the parents and take baby back. I have them less than 5 minutes total. We swaddle them, we take before and after photos, and then I use a CO2 laser to, you know, whether it's lip, buccal ties, or tongue tie, or a combination, whatever. Ultimately, less than about 30 seconds of laser time. And as soon as I'm done, I take baby right back to parents. And, you know, again, I'm focusing kind of on infants here. I do children and adults. Children are similar. It's usually with the laser, a quick, you know, 30-second procedure. I actually do a different technique on adults. It's called a functional frenuloplasty, which is kind of more in depth. I learned it from an ENT in Los Angeles named Dr. Zaghi from the Breathe Institute. He's kind of pioneered that adult version of a tongue tie release. And I guess I'll just talk about that for 1 second. He's really focusing on function and fascia, because what he found was that kind of quick frenectomy, where we're cutting through the frenum and kind of the mucosa of the tongue until you see, you know, that vena glossus muscle, and there's that septum in between, like right under. That's as deep as you go for infants and most kids, really. But when you get to older kids and adults, you get in there and you actually just see like white, this webbing of fascia, and that's part of the restriction now, because it's years or decades of improper use and dysfunction. And so that fascia has kind of built up. And so unless you address that, then you're not really going to get a great result. And so it's much more in depth, kind of actually dissecting that fascia and everything. So that's kind of a longer procedure. But as soon as the infant is done, my IBCLC, lactation consultant, spends about 30 minutes with the patient. And I guess what I forgot to say was all of my patients get 30 minutes with our massage therapist before the procedure as well. And that body work is often forgotten. But I think it's one of the most important parts. Is, again, we're kind of addressing this entire system, not just a tooth, right? It's this body works all together. That fascia goes from tongue to toe. And so the more we can get the patient relaxed and kind of address other types of tension or resistance in the body, the better job I can do and the better they will do afterwards. So my whole team works with every patient. And then I also have a myofunctional therapist on staff. And that, again, it's, you know, the personal trainer of the mouth, someone who actually teaches people to use their tongue and lips and cheeks and jaws the way you're supposed to, rather than just whatever you think your normal way is.
So let's talk about that. So what is considered normal? Because I guess there is kind of an unknown about this is just how you develop your, like you mentioned when you were 34, that your resting like tongue position was where it was. So how do you know or realize as an adult, maybe even a child, that hey, like maybe this is a compensation pattern, or this is something that's not normal?
Yeah. And, usually it comes down to symptoms. I mean, I have this checklist that Dr. Baxter, sorry, I'm going to take a drink of water. Dr. Baxter wrote the book Tongue Tied about 3 years ago. A huge collaboration between lots of different kinds of specialists. It's really kind of the textbook, I'd say, even though it's meant more for parents or lay people. He has this amazing checklist: feeding issues, speech issues, body issues, sleep issues, and then some like miscellaneous. And I definitely get people in my practice who they don't check any, the parents don't check anything on that list. And I'm like, oh, so what brings you here? And they're like, so and so says my kid has a tongue tie. And I'm like, but you're not seeing any of these issues? They're like, no, my kid's fine. And okay, well, let's take a look in their mouth. And sometimes I'm shocked at what I see, and I go, okay, they really, they don't have any of this, any of that. But you start digging a little deeper and you find out it's not that there's something wrong, right? But it's definitely not optimal. The kid isn't sleeping as they should be, but they don't know any better. To them, that is normal. And so they're not going to consider that a problem until I educate that this is actually how kids should be sleeping, and this is how kids should be whatever. A lot of times we see the venous pooling, the really dark shadowing under the eyes, or the kid's mouth breathing. He not used to using his nose, and again, if you don't know any better, then you just think that's your normal. And even knowing what's normal, right? After decades of swallowing however I swallowed, it's very hard to teach yourself a new habit. I get a lot of parents of the babies who towards the end of the procedure, like my last follow-up with the baby or whatever, they'll go, so what about me? I've learned so much. I realized that I'm tongue-tied. And I'm like, yeah, I know. And they're like, well, should I get mine fixed? And I'm like, okay, well, tell me a little bit about your sleep and, your breathing and your body. And they're like, no, I'm fine. No problems. So maybe you're not in a right place to go through this process. Again, like, my part is not the fix. You really have to habitualize and make these changes to your habits and your body to see the results. And you have to have certain goals that make sense for actually getting this procedure done. Like, I wouldn't recommend that everyone just, because I guarantee there are a lot of tongue ties out there undiagnosed in adults, and they don't even know it. Doesn't mean I would recommend they all run in and get a tongue tie release. But if you have sleep issues, sleep apnea, snoring, your teeth are crooked or crowded, you have a lot of chronic neck tension, you feel like it's hard to breathe, you choke on water, you get really tired after talking for a full day and you start stumbling over your words more. Some of those are things that adults might notice that they just thought were part of their normal. That's just who I am. That's how it is. When really it comes back to like what your tongue did when you were born. So, and that's the other thing I say to adults a lot is, at this point, as an adult, it's so far past the tongue tie, because we also need to address the anatomical changes that have occurred from that dysfunction. Meaning, do you have a narrow palate? Do you even have room to suction your tongue up to your palate. If your jaw is so narrow that you're trying to suction your tongue up and it's like flopping over your teeth, a tongue tie might not do a whole lot for you because you don't have anywhere to put it. And that can be hard to hear for people because they've read that a tongue tie is causing all these problems. It's like, well, honestly, yeah, you got to get expansion. Like as an adult, you need to kind of make room for that tongue. Stuff like that. Like you don't move your body. Okay, well, when I cut that tongue tie, you're definitely going to feel like, oh, wow, that feels great. But are you going to start doing yoga every day? Like, are you going to exercise and are you going to move it? Because if you don't, you're just going to lose it again. So it's definitely, it's really part of a lifestyle change, to be honest, for adults, rather than a solution for anything.
So you mentioned in adulthood, some of the symptoms that someone might experience, with poor sleep habits or even mouth breathing or noticing things in their lifetime. What do you notice as that's the case of how that develops into their childhood? Can you tell us more about like how that develops and what kind of symptoms you can expect as an adult versus a child in childhood?
Yeah. So, a speech therapist and I always joke about when it's going to finally hit us. Because I still have a tongue tie. I have not had mine treated yet. Mostly it's because by the time I was like, okay, I think I'm well prepared for my procedure. I got pregnant with my third child and then COVID hit and I would need to travel to someone who I trust to do the technique that I want on myself. So I haven't had mine treated yet. My colleague is in the same boat and we're both, around 40 and we're joking like, we don't feel completely broken yet, but any day we're going to wake up and we're the tongue tie is really going to hit us, the effects of it, jokingly, but it's to the point that we're so good at compensation that we can really hold off a lot of those symptoms when we're young. And so, that's why when you're working with infants and children, it's really those big ticket items, speech and feeding, that people are paying attention to, because those are the things that we need to kind of be successful as humans. And then, these other things kind of sneak in there. I think overall, breathing and sleep is so misunderstood by society, the importance of it, what is good sleep and breathing and what is not good sleep and breathing, that's getting missed constantly in children. And that's another reason why I started pursuing kind of supplementary treatments to tongue tie, like expansion in children to kind of get the jaws back on track, because that really helps with those things, that sleep and breathing. But anyway, so those things are just being generally missed: poor sleep, poor breathing in children. And then it just becomes habitualized. I've always grinded my teeth at night when I've slept. I've always slept with my mouth open. I've always snored, and it just becomes part of your normal, who you are, not ever realizing that it was dysfunctional when you were a child as well. And it's dysfunctional now, and it is affecting you. Another thing that I've really focused on learning this year is adult airway appliances, sleep appliances. So it's an alternative to a CPAP if you have sleep apnea. In certain cases, it's an alternative. And really, all it does is, if this is your normal bite, it pushes your jaw slightly forward, not significantly, but maybe like end to end. And that opens up your airway a little bit. It literally, your jaw coming forward makes the airway hole just slightly bigger. And that can cure or significantly improve the symptoms of sleep apnea and snoring. And that's a Band-Aid. I kind of avoided it for a long time because I had this idealistic view of I only want to treat root causes in my practice. But, you know, as I was kind of talking about earlier, that if your tongue doesn't fit in the roof of your mouth, you might need expansion first to even get the benefits. And I mean, I haven't even done it. I know a lot of adults are not going to take the time, money, and effort to go through kind of this really long, complicated process because, you know, they snore at night. And so I was like, well, you know, if there's this thing that can help with that, and you ultimately have to meet people where they're at, right? They're not ready for all that. That doesn't mean that there's not something that can help them. And so, you know, these sleep appliances help with that. And I use my husband as a guinea pig a lot. He's kind of a skeptic about everything. And I was gonna also mention lip taping and breathing, which again, I used him as kind of my guinea pig. And he's been wearing the sleep appliance for a couple of months now. And I mean, his snoring is reduced by 90%. And we actually, I was trying out expansion on him and he hated it. He just didn't want to do the process. It was uncomfortable. And so if we weren't going to be able to right now or ever, you know, treat that root cause, well, at least, man, he's sleeping better each night. And he didn't think his sleep was that bad. He doesn't hear himself snoring. We did a sleep study. I have, you know, in my office, I have a home sleep test that I use on my patients, and he does not have sleep apnea. But snoring is a precursor. It's still affecting you. And he started waking up actually feeling rested. And, you know, he thought he was feeling rested, but now he's actually feeling rested. And I see that a lot with my patients is you just don't even realize how dysfunctional it is because it's just what you're used to. And I think another thing that's important that I wish more people understood was, especially women, especially mothers, we've really been brainwashed to think like it's okay to be tired all the time. It's just, you know, you're busy, you're working, your kids, like you're going to be tired. And like I said, specifically, I think mothers bear the brunt of the kind of that attitude, but really all humans in our society, it's like, you're not killing it if you're not tired, right? Like successful people are tired because you're working hard and you're sacrificing sleep to accomplish goals or whatever. And it's just not true. You shouldn't feel tired. And so a lot of it is what they call sleep hygiene, you know, going to bed at a similar time, dark room, cold room, breathing through your nose, not using screens before bed, stuff like that. But if you are doing those things and you're just still waking up tired, you probably have a breathing problem. And it is rampant. Sleep apnea was always kind of considered the old fat guy disease, right? And what we're finding is that that's not true at all. If you want to kind of generalize in the other direction, you've got upper airway resistance syndrome, which is more like the young, fit woman's disease because they don't have apnea. They're not stopping breathing while they're sleeping. They might look peaceful while they're sleeping, but their body is working so hard to get that air from their nose or their mouth to their lungs that they're having a lot of the same symptoms. And that is less diagnosable. Like that's not really going to show up on a sleep study unless the person reading the sleep study is kind of diving more deep into it, looking for specific markers. And then ultimately it's a symptomatic diagnosis as well. You know, if you're getting 8 hours of sleep and you're tired all the time, there's probably a problem with how you're breathing. So it really is just about awareness. I love the concept of you put things in order of survival, right? Like what's first? Breathing. What's second? Sleep. What's next? Water. What's next? Food. But no one's talking about breathing, right? And it's literally the most important thing to being alive.
Yeah, I feel like that's definitely overlooked. We see that the same thing in our practice too, is that people don't really pay a lot of attention to how they're breathing or how they're just ventilating or getting air in. And then when you ask them questions, like, oh, I've always done it like that, so it's fine. So, well, just because you've always done something doesn't mean that it's always fine. Like maybe there are ways you can feel better.
Absolutely.
Let's explore some of those things.
Right. And you're here because something's not right. Right. So like this is part of it. Give it a try. Yeah, it's really just kind of taking responsibility for the fact that not everything's a quick fix. You know, if we want to solve a problem, we do need to dive deep down into root causes, and a lot of it is sleep and breathing, and those are much harder things to fix. You know, it takes more work, it takes more effort. So, you know, again, some people are going to just say, well, you know, give me that thing so that I sleep better. It's like, if that's all you can do right now, and that's going to give you the energy you need to kind of start addressing other problems, health related issues, then maybe that's the right step for you. I was also going to say, you know, yes, breathing is about getting that air from your nose to your lungs. Keeping your tongue up actually helps with that, because it keeps the airway organized, right? Like all the muscles are activated, and it kind of keeps that hole open and keeps things going down. It keeps the airway open for things to just go smoothly down. When the tongue is down in the floor of your mouth, just kind of loosey-goosey, not really activated, it actually bulges back partly into your airway, like falls back. And then of course there's the classic, like then you're laying on your back sleeping and then it really falls back and occludes your airway. But just in regular life, you know, if you're just sitting there and your tongue is down, it's going to make breathing slightly harder. And again, it's just like my observations, but I think that leads to chronic mouth breathing a lot in children, because the body just gets overwhelmed. Like, this is just too hard. It doesn't need to be this hard. And so you open your mouth. Now you can get a much larger volume of air to bypass those obstructions. And, you know, your blood pressure might elevate a little bit, like your heart might have to work a little harder to process, your lungs might have to work a little harder to process the oxygen, but your brain is more satisfied. And that's ultimately what's going to drive everything. I can kind of bring that back to infants. Is I refer a lot of babies to feeding therapy, but once babies are like 2 to 3 months old, I actually require it before I will do the procedure. And it's because they're alive. Like, their brain has succeeded in keeping them alive. Parents might have had to, you know, supplement with bottles even if they didn't want to, or whatever compensations have been made. The brain is satisfied that they've kept the human being alive. And so there's going to be zero motivation to suddenly use your tongue completely differently. So I really, with all ages, you're trying to change the human behavior and make it initially harder to make it easier in the long run and to make health improved in the long run. But it's really hard to get the brain to want to bypass that little hill you have to do first.
Yeah. So it's interesting too, because we've read a lot about nasal breathing and how, mouth breathing can change the way jaws are shaped and, those types of things. But as you go into childhood, you go to a dentist and I think about just my experiences with the braces and seeing like, what happens. And a lot of it is probably cosmetic for a lot of people too. Like you want to have straight teeth or whatever.
Sure.
But how does that impact in general? Like if you're generally looking at quality of sleep and quality of breathing and those types of things, what are you and looking out for and like noticing in big changes in how people's mouths have developed maybe in age 5 to adulthood, or if you will, now just like more recently, as there's more education surrounding sleep and nasal breathing and those.
Yeah. So it really, it comes back to where the tongue is living. So if the tongue is living on the roof of the mouth, then you're going to get these nice tongue-shaped upper jaw, literally like this wide U. Then you're going to have room for all your teeth to come in. Like it works together that way. And in most cases, the lower jaw is going to grow to meet the upper jaw. The upper teeth are in front of the lower teeth. And it's just kind of this natural progression. Okay, now the jaws are nice and wide. There's room for 32 teeth. You don't need braces because there was room for everything. Crooked, crowded teeth are a sign that the tongue didn't do what it was supposed to. The palate didn't get shaped properly. And nobody really thinks twice about braces. If your parents were told that you needed braces, I mean, I know my mom was like, yeah, cool. Like I want her to have nice, pretty straight teeth. And I appreciate that, but it's totally missing. It's another Band-Aid. Right? It's totally missing the root cause of why the teeth were crooked and crowded in the first place. And then again, the size and shape of your jaws correlates to the size and shape of your airway. And so if you needed extractions, if you had crooked and crowded teeth, then your jaws were not the right size for your face. And your airway is probably going to be smaller too. The reason mouth breathing correlates with that is because you have to have your tongue down. If your tongue is up where it belongs, you literally can't mouth breathe. You have to
testing it out. Yeah.
breathe through your nose if your tongue is where it belongs. So again, mouth breathing comes down to like this tongue dysfunction. And in many cases, it's not that you physically can't. Like I said, I have a tongue tie. I definitely am challenged to get the very back part of my tongue up where it belongs. And that could improve with a release, but I can still do a good portion of it. And maybe again, with overcompensation of my neck muscles and face muscles to get it where it belongs. But, it's rarer that the tongue tie is so significantly tight that you can't get any part of your tongue up. I definitely see it. I see it all the time. But again, just because you have a tongue tie doesn't mean you can't get your tongue stronger. I tell my patients all the time, like, I've never run a marathon, but I probably could if I trained for it. I think that my body is capable, but I wouldn't know until I trained for it. And I use that as an analogy for why the feeding therapy is so important. We won't know what the patient's tongue is capable of until we try to see what it can do, and it's much easier to try to see those things before they're sore and hurting from a tongue tie release. You wouldn't do a shoulder replacement surgery without doing some physical therapy first, because then you would just be weak and in pain, and it would heal poorly, right? So, kind of, again, questioning why we have the interventions that we have. Just because you needed braces tells me that things weren't really going in the right direction as a child. And you can notice that. You can notice that in a 2-year-old, in a 3-year-old. If you see a little kid and their baby teeth are all touching each other, they're already crowded. Baby teeth should have nice spaces between all those baby teeth, because our adult teeth are like 50% bigger, each individual one. And so if you don't have spaces between your baby teeth, there's not going to be room for those adult teeth. And I remember leaving dental school thinking, like, or just maybe not thinking, but that when you see little kids with these pretty little picket fence baby teeth smiles, that was nice, oh, they have a nice little smile. And then it wasn't until later that I realized, like, oh wait, they're supposed to have spaces between every single tooth. Like, and then the parents are worried about gaps. Like, that's kind of how society, again, has like completely changed what's normal. They've turned what's common into what's normal. So, you can notice that stuff in your kids. If the top teeth are not in front of the bottom teeth, if you have them bite and, one side of the back teeth is like inside the lower teeth, like a cross bite, or if you bite and there's a space somewhere where your teeth are not touching together, that's called an open bite. Sometimes you see it a lot with like pacifier usage in the front, like the kid bites together, but there's actually kind of a hole between the front teeth. Or there's even posterior cross bites, which come from how they swallow. It's called a posterior tongue thrust. Every time they swallow, the tongue is going wide. And so they'll get like spaces between their back teeth when they bite down. So you can notice all of these things. It's just that no one's looking for it.
Well, we really appreciate your time today. Is there anything that you want to leave the listeners with?
I guess I will say, to bring it back to infants for a minute, some warning signs that your baby might need feeding therapy. And that's my biggest recommendation. Like, don't come see me. Go see a feeding therapist, because if your baby's spitting up, you guys have to change your clothes. It's happening after every feed. If baby's acting just uncomfortably gassy and crying, and they're like tucking their legs in and kicking their legs, on the breast or the bottle, you hear that clicking noise, or milk leaking out. Obviously, if you have pain while you're breastfeeding at all, pain is not normal. Those kinds of things are not normal. And the mommy groups on Facebook are the worst, because everyone will say, oh, that's normal. That happened to me. My kid did that. And it's not. Quality of life really matters. And so if feeding just feels hard, there are resources for you. There are solutions. And I would encourage you to pursue that rather than just struggle. So yeah, I guess that's my wish for new moms, is that if you feel like feeding is harder than it should be, that you reach out for support rather than just kind of brush it off as normal, even if that's what you're hearing from your medical professionals, that it's normal.
And how can people find you?
They can go to my website, smartmouthlv.com. I've got all my information on there.
All right. Well, once again, thanks. Really appreciate your time. Really enjoyed the conversation. I feel like we learned a lot.
Good. Thank you so much for having me.
Thank you.
Thanks. We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast or any combination of the three. Thanks again, and remember to take care of yourself.